Hi guys, I know I haven't done a video in a really long time, but I'm back. Well, I'm back with my dad, and I've just been talking to him a lot about anxiety and stress and the state of the country and different things. My dad thought it was really important that we reach out to anyone that has mild to severe anxiety and doesn't know the next steps. We just thought it was really important to put out some information about anxiety, how it manifests, different coping mechanisms, when you should seek help, how to seek help. Do you want to start off by saying kind of what anxiety is and how it manifests and stuff like that?
Yeah, I'm glad we are talking about anxiety, which is a very common symptom of psychological issues, psychological problem. Initially, it can be like emotional issues of any life problem you may encounter. It is a defense mechanism of the brain. So it's like a flight mode. Your body is going to, in a defensive mode, is going to react. So what are the symptoms of it? So the two things. One is physiological symptom, which you're going to experience in the body. What it means is nervousness, sweating, increased breathing, and it's moving on to, if the anxiety is severe, you go into a panic mode where you feel although you are breathing, you feel as if you're not going to breathe, and the other thing is you're going to feel as if you're going to die, you're going to choke and die, and that kind of thing. So the anxiety which leads to panic attack usually sends people to emergency room, where they go through a gamut of cardiac investigations like enzymes, EKG, stress tests, and all of that kind of thing. And emotionally you feel very anxious, nervous, as if something dread is going to happen to you. So those are the physiological symptoms and psychological symptoms.
How do we know the difference between nervousness and anxiety?
Correct. So that's an excellent question. So every day we experience anxiety, but we manage that. For example, you are going for a job interview, you're waiting in this sitting room, you are very anxious, nervous, sweating, you keep on going to the bathroom and fidgety and all this thing. And then when you're done, you feel you have done well, and then the anxiety disappears. That's how normally it happens. Commonly, everyday kind of things, which normally all the anxiety symptom, both physiological and psychological symptom comes, and as you face the situation, then it disappears. But if it continues to exist, it continues to manifest, and it affects your day-to-day function, then it becomes a problem. Like, for example, the very common things, the social anxiety. People are very uncomfortable in a big crowd, so they don't like to go to parties or even family get-together, so they're isolating themselves and staying in home. And anytime they have to go to, for example, shopping they try to avoidance is one of the defense mechanism. So you go in a very late, like for example going to the supermarket, you go like 9 o'clock when nobody's around, you just go pick up a few things and dash back to the house. Mostly you're isolating yourself, not wanting to interact, not answering your phone, and that kind of thing carries on.
So what are some good coping mechanisms for dealing with mild anxiety?
So the mild anxiety, the good coping mechanism is talking to people, talking to family members, talking to your peers, talking to your friends, and talk about it, and by that you're able to help yourself. Or sometimes yoga, some meditation, exercise. Exercise is an excellent mode of relieving any of these psychological symptoms, anxiety, depression, whatever it is. And it really does help a lot. I'm telling you, a lot. A lot of the people get benefit from that.
So what if someone is really nervous to seek help? Being vulnerable for a stranger is very difficult. Probably that's something that will hold people back a little bit.
Right. So a lot of the times people, they have this inhibition and they don't feel like going out and talking even to your close friend or to your partners and their family members. Sometimes they suffer, but as I said, in isolation you can still seek help, calling by 800 number, so others don't have to know about what you are going through. Isolation is the biggest issue with this. If you don't seek help, it's going to become chronic and debilitating. So that's the main thing. The time you realize anxiety is taking over you is your day-to-day functionality. Your work, your school, college performance, academic performance, your connection with others are all limiting. So the main thing, you don't want to talk to people and you don't want to answer phone and you're not in the social media, then it becomes a problem. And you don't take initiative to call friends to go. So those are the initial steps where you realize things are taking over and affecting your day-to-day life. And those are things where you need to start taking steps to help yourself. And a lot of the times, the main thing is that people really believe that they are suffering and they're doomed to suffer. But it's not the case. There's always help outside where they can seek, and you would be amazed how much help you can get and on these things and how quickly it can help you.
So how does one find a psychiatrist or a therapist to talk to?
To find a psychiatrist and a therapist nowadays is very difficult. When I say difficult, there is a very long wait period to see a psychiatrist. Usually if you're a new patient, you have to wait for 6 weeks minimum. And to see a therapist at the same time. The best way is to connect with the 800 number or call your insurance company. They will have a list of people where they will help you, where you can go, where you can seek. Sometimes they themselves call the psychiatrist and the therapist to see if they have someone who help immediately, if they can accommodate. If you're really desperate to get help immediately, you can always go to emergency room where people will see you. There's a psychiatrist available, there's a counselor will see you right away. So you see a psychiatrist and they will give you an appointment to see a counselor and a psychiatrist much quicker than if you start looking for yourself. So that is another way. But people don't want to go to the emergency room because a lot of the people don't get to the panic attack stage. Mm-hmm. They have a severe anxiety and they wanted to get help, but they suffer and they self-medicate with all those kind of alcohol and whatever you have available outside, and then it becomes a problem.
Would it be wise to call your primary care physician and they can find you a psychiatrist or a therapist?
That is one of the ways, yes. You talk to your primary care physician and let him know, and they will also help you with some medication and also try to get you a psychiatrist and a therapist much quicker.
I asked some friends and family if they had any questions about anxiety, whether they're dealing with it or they see somebody else dealing with it. And questions that came up most often revolved around CBD oils and weed and whether or not we can actually help ourselves with those kinds of self-medicating.
So marijuana is, I've seen a lot of my patients using marijuana, a lot of others using marijuana for various ailments, for sleep, anxiety, depression, and all of that, including the CBD oil. It may help temporarily, but as a psychiatrist, when someone is suffering from anxiety, there is a temporary benefit, but in the long run, I do not recommend weed, CBD oil, and now I've seen it even comes in a chocolate form and all of
Chocolates, gummies,
all of that. So it's not really helpful when someone is having anxiety, and if they don't seek help in a proper way, it's not advisable. For younger people, CBD oil, weed, and all those things are a different category, whereas yoga, meditation, exercise are a different thing. It biologically enhances, secretes endorphin, which relaxes you, and with the endorphin, which is one of the neurotransmitter in the brain, it affects other neurotransmitter, particularly norepinephrine, which is the sole cause for anxiety and panic attack, whereas weed and CBD oil is not proven to be affecting some of these neurotransmitters. It does affect anxiety and maybe in a different, it does affect in a different way and helps them, but not in the same category, same way like how some of the other things will help you.
So if you have very mild anxiety, you can take CBD oil and smoke weed, but that's kind of like a band-aid, right? Like
Correct.
especially if you
Yes.
if it's getting worse. If your anxiety goes away after you do those things, that's fine, right?
Yes.
It's fine. But if
But
it
again,
persists,
anxiety goes away and then it will come back.
Yeah.
And then you take another joint and then it goes away. And then it comes back. And then it becomes a chronic problem. Yep.
you're not processing what's going on in your
Correct. So
head.
that's the key word. You need to process what's going on in you to have that anxiety. That is the key factor. So that is why you need professional help. People like psychiatrists and psychotherapists, counselor, able to delve into why are you having this? What is causing? And that takes a lot of sessions, step by step. Slowly they need to do that. The yoga, meditation and all of that will help you. And those are the things which are generally in a healthy living, a
But
healthy
do you also
lifestyle.
think that yoga and meditation, because you're not processing what's going on in your mind, those are also band-aids?
Correct. Yes. So that is another thing. You have anxiety, you go and do yoga and it goes away and you keep on doing it. And sometimes it helps even in the long run because human beings over a period of time is the biggest healer here. Over a period of time, you tend to forget about those things and it becomes your natural way of lifestyle. So there's no anxiety and you start doing exercise, yoga, meditation 2 times a week, 3 times and then every day, and then anxiety goes away. But the root cause, the processing is the key thing. Why are you having anxiety? Because it may disappear. I've seen people getting over the anxiety in their teenage, in their early 30s, and then when they're 50, bang, there's a recurrence. They don't know why it's having. Now they are having anxiety, and they can't figure out what is causing it, and they end up seeing a professional help at that time. A lot of the times people come to me and they say, I can't get out of the house, I can't go to the supermarket, I dread going to work and I dread going to school because I can't face people, I get nervous, anxious, my heart beats up. Those are the time. It doesn't start off like that. It's, everything starts in a minuscule way slowly and progresses to that level. And you don't have to leave it up to that level. As I said, some of the earlier symptom is nervousness, anxiety, palpitation, heart going, beating fast and all those things. You realize and then, you start doing the simple things, healthy things, which is exercise, meditation, yoga, and all those things.
Some people that I've talked to that have anxiety are worried about medication.
Well, the medication nowadays, there's a number of medication. Even to sit down and talk to your therapist sometimes, or even come to a psychiatrist office. Some people have dread of waiting in the waiting area where a couple of other people, they start thinking, I can't take 4 people sitting here and all that. So so definitely in those situations, medication has a role to play, because to help you to calm down, to take away your anxiety, so you are relaxed, your anxiety goes away, you are able to walk to the office and able to talk to the therapist and psychiatrist about what is causing it. So the medication does play a role. So medication and therapy complement each other, and the success rate for curing anxiety is much higher when both are done simultaneously and consistently and persistently for a long period of time.
So medication will not zombie you out?
No, it will not
Okay.
make you zombie you out.
I think that's a big worry in people, that
Yeah.
they won't feel like themselves if
No.
if a psychiatrist tells them, okay, I want you to be on meds.
No, that is a very wrong perception. These medication taken with advice, and if it is taken as it is prescribed, it's not going to make you zombie. The common worry about these things, a lot of the people telling me that, doctor, I don't want to be addicted to this. I don't want to be hooked on to these medications. So you don't have to worry about any medication. As you see the psychiatrist who helps you to get over the hump initially, so that you can continue therapy and to work and process with the therapist and the psychiatrist the root cause of this thing, the medication gradually is going to be decreasing. So you need to set your mind, this is a temporary thing, and the doctor should be telling you, you know what, I'm going to give you this temporarily for next 3 months until you get over some of these things, talking to your therapist and process. After that, going to be a point where you're not going to be on medication, just the therapy and seeing me. That is how it is done, and it does help. A lot of the times people start with the medication, which helps them tremendously, because medication has the very quick effect and they feel right away much better. So they think, oh, all I have to do is to go and see Dr. Gazaraj, take a pill. I don't have to go and see a therapist and a counselor and all that, costing me. I need to take another time off. I need to drive and another copay. I don't have to do all of that. So they just rely on medication, which is not a good thing. It's not a healthy thing. It's not advisable.
How does someone find the right psychiatrist? Because I feel like seeing anyone isn't really something that a lot of people feel comfortable doing, especially you have the fear of, oh, are they going to judge me? What if there are cultural differences between the psychiatrist and myself? What if they don't understand the family dynamic that I have? Different things like that.
Well, it's an excellent question, actually. A lot of the times, finding the psychiatrist and your therapist can be a challenging, daunting task. And it's like trying to find your partner, trying to find your house, trying to find your car, all of that. Even if you decide you want to go and eat, and which restaurant you're going to go, then you have a gamut of things in front of you. You have a lot of options here. So, but trying to pinpoint. Whereas seeing a psychiatrist and a therapist, as I said, is a challenging. She pointed out an excellent thing, a cultural difference. Plays a major role. One of the major things, how the person is going to look at me, how he's going to judge me, and so that kind of thing comes in. But again, you have to take a chance and go and see. A lot of the times it doesn't match, and so you try to say goodbye. Thank you very much for seeing me, and I'm going to go and look for somewhere else. That's what it is.
So if it doesn't work out the first time or even the second time, what would your advice be to those people who are having trouble even finding someone to talk to?
Sometimes it may not work. It's not like all the time. It is like that. There are a few things it doesn't match. So both the therapist, psychiatrist, and you, it's a team. It's a collaborative effort. It's not always on you. It's not always on me. It's a joint effort. Both have to work and work together collaboratively. Whenever I see patients, I tell them, now you had a problem, now it has become my problem, so we both have to work together. If you persistently stay there and try to understand, try to talk to the person, either psychiatrist or therapist, eventually it will work in spite of the cultural difference, in terms of other difference, whatever can be, race, gender, and you can put whatever you want. Eventually it will work. There's going to be compassion from the therapist and the psychiatrist, and to help you. And sometimes it doesn't work, and that's very unfortunate. When I go to the hospital, and sometimes they say, I don't like you, I need a white doctor, or something like that. Then all I can tell you is, I'm here to help you. Is there any? No, I don't want to talk to you. I want a white doctor. I want a white psychiatrist. I want a white doctor. Or sometimes I don't want to talk to you. I want a female doctor. Is there anything I can have? No, I don't want. So these are the things you would face in everyday life. Ultimately, the person who's suffering is the one who's looking for help. And you really need to see, I need help. Sometimes I ask them, people, when they come to me, how much it is affecting your day-to-day life, how much it is affecting your functionality. They say it affects me tremendously. It affects me in every area of my life. What are you willing to do? And sometimes they may say, doctor, I'm willing to do anything, whatever you say. Sometimes they may say, you know what, I'm willing to do only a few things. If it doesn't work, I'm happy to suffer and happy to keep on doing what I'm doing. That's what it is. So people who are suffering need to come to work with the therapist and the psychiatrist, and eventually you will feel much better, and there is a long-term sustainable cure to it.
What would you say to people who are worried about insurance and being able to pay for a psychiatrist?
Well, the insurance is a big thing, and sometimes people don't have insurance, and a lot of the times they come and I see them. Sometimes I cut down my fee. Sometimes the office has a kind of payment plan you can do, so you can start paying $10 a month or something like that.
So it's important to find psychiatrists like you that will still see people who don't have insurance.
Correct. Nowadays everything is insurance driven. They say, you know, doc, I don't have a job, and I have a child, and I'm living on disability, but this is very bothersome. I want help, but I don't have. So I tell them, okay, we're going to put you on a payment plan. You don't have to pay every time. Come $100 or whatever it is, start paying at least $10, $15 every time. Over a period of time, you know, when you have insurance, when you have a job, when you feel comfortable, you can start paying.
So it's important to find a psychiatrist and a therapist that will work with the patient as well, because there are doctors that will say, okay,
right,
you might not even have to pay any now, right?
Correct.
And you can pay when you have your life
Correct.
kind of more settled.
Yes, yes. There are people you need to find, and it does help. There are people in the community, there are a clinic in the community which would help you. Yes, you know, you really need to feel secure, thinking there is help. There are hundreds of people like you are suffering. Hundreds of people like you are in isolation. All of them need to think there is help. There is a resource outside. And call your insurance company. Call your primary care doctor. Try to get some help.
What would you tell people who have friends and family who are dealing with anxiety but are too debilitated to do anything? What would you tell them? The same thing?
The same thing. You can help them by checking on their wellness. I think that's what our friends are for. Friends and family are for checking on them to find out what's going on and to try to help them. So I'm happy to talk to anyone who wants to call me and talk to me, and call me anytime. I'll try to help you as much as I can.
People can call you even just to consult how to get to the next step, how to find a psychiatrist, even if they don't want to see you.
The moment you talk to me, everything is confidential, but I cannot have a doctor-patient relationship outside of my office and all these things, because some of these things needs to be documented, and because of HIPAA. HIPAA is the federal government privacy policy. So I can generally talk to you how to go about helping yourself, or if you want to see me, I can tell you how to, what is the proper channel, where to contact, who to contact, and see me in a formal way as a patient. I can do that. The take-home message is like this. The first and foremost is you need to realize there is always help outside. There's always help, and you need to seek the help. And there is an 800 number, or you can call Ro or call me, and I can help you with that. With the help, it is curable, and you can lead a normal life and become sociable and all of that kind of thing. So the take-home message is, please don't suffer. Please remember, there's always help. There is resources, a lot of resources. So don't suffer and feel isolated in this.
Because everyone goes through anxiety, whether it's mild or severe.
Everyone goes through anxiety. So remember, there's help.
Thanks for watching. I hope this helped anyone out there who's wondering what are the next steps to seeking help if you have anxiety. I'm going to put some resources in the description of this if you want to seek more help or just explore more about anxiety and mental health.
Yes, thank you very much for watching, and I hope it is useful and helpful, and I'm always here to help you. So reach me through my daughter. Thank you. Have a good day. Bye-bye.